And we are live. It's Dr. Justin Marchegiani here with Evan Brand. Today, we're going to be diving into the topic of looks maxing, improving your skin, improving facial structure. We'll be diving into kind of natural ways that this can be done because being healthier is going to improve how you look for sure. And we're going to dive into those aspects today. My man, Evan, how are we doing, man? Are you safe down in Florida, away from the
Yeah, we're
hurricane?
good. Yeah, we're good. Luckily, it's blowing the other way, so I feel bad for all those people that have to move and go to hotels and uproot their life for a while. But hopefully, it'll blow through, and maybe the media just blows it out of proportion, and everybody will be not as bad as they'll say.
Yeah, 100%. So, kind of a little bit more of a superficial topic, but being healthier, reducing inflammation does allow you to look better, right? You're going to have less of that half moon face because we know excess cortisol, excess stress, excess inflammation, we're going to get more of this half moon type of face here when we're stressed and inflamed and cortisol is present. And so by just getting inflammation down and getting our cortisol in check, is going to allow our skin to look so much healthier just from a jaw standpoint and also from a symmetry standpoint. In the world of plastic surgery, there's a what's known as the Marquardt mask. You can Google it, Marquat, Marquardt mask. But it looks at this kind of the special ratio that happens. And when you look at anyone that's attractive and they overlay the kind of the Marquardt mask, their facial features tend to align within that golden ratio of that Marquardt mask. And so, again, the healthier you are and the least amount of inflation. Well, we got a lot of that today, but inflammation, the more symmetry and the more you're going to be able to see that jaw structure. Because if we get, I'll pull up here half moon face and cortisol. The more inflamed we get, the more cortisol we make. Okay, and that is going to have an impact on how we look and our jaw structure. So I'll pull this up here in just 1 second.
I've definitely noticed a difference in myself just over the years. I mean, dealing with mold. My wife and I, we've been together 15 years now. I mean, when we first got together, I looked at pictures of myself. I definitely had more of like a swollen face. And I think there's even a daily or a weekly cycle. I mean, do you notice that in yourself, like in the morning versus the middle of the day? Like your lymphatic system's been sitting all night. In the morning, I feel like I feel puffier. And then as the day goes on, I get moving, I go swimming, I hit the gym, I ride my bike. I feel like by midday, I look different than I do in the morning. Do you experience that at all, like a daily shift or not?
Yeah, I mean, just by jacking up your insulin, right? Just by getting your insulin overly jacked up, that's going to cause excess fluid retention. And you may start to notice it on the face. Some people will notice it first come on the face. And so when you start to jack up cortisol, for instance, you tend to have high insulin. Sodium then follows insulin. Water follows sodium. So you get this excess fluid retention. Plus you drop out potassium. So potassium is really important for your heart and for your adrenals too. And so that can create all kinds of problems. So, I mean, here you can see this guy right here. You can see the shift in this face to this face here, right? And this is a salivary cortisol kind of pattern here. This is Cushing's syndrome. This is going to be a lot more severe, but that's that half moon face. You can see here as well, right? See that half moon face and see how it slenders out. And again, this is cortisol at a pathological level, right? You can see
We
this
can
girl right
measure
here.
this. We can
You can
measure
see
this
this
through
girl right
urine,
here,
urine or
this girl right
saliva.
here versus here. And so a lot of this has to do with inflammation, right? Has to do with insulin, has to do with cortisol causing insulin because cortisol is going to be catabolic. So it breaks down protein. So you get you get less muscle, but then it also causes excess glucose because it's a glucocorticosteroid. The glucose then causes an insulin spike, and that insulin causes sodium, and that sodium causes water. So then you get this fluid retention. So that's a big one. Here's a good one. This is a great one to see here. Tom Brady face over years. This is an awesome one. We did a video with Santa Cruz Medicinal, Brendan Rue, on this topic, and this is one of the things that came up. This is an awesome one. I'm gonna get this up, big one here.
What do you think for you? Do you notice in the morning versus midday? Do you feel like you have difference at all with like hydration, stress, or do you feel like you look the same all day?
I mean, I definitely notice if I drink excess alcohol, right? That's going to be a big one. If I drink too much alcohol, too much carbs, if I'm eating a little bit lighter, especially if I do a little bit of intermittent fasting, I definitely I notice an improvement. So here's a cool article. Photos show Tom Brady looks younger now than 20 years ago. So, I mean, check this out, right? So this is like 2000 right here. He goes into the league. That's him right in 2000. You could see here, So the 2001, 2, 3. So it starts to get a little bit better here. So if you listen to him in TB12 method, he talks about like after games having subs and hoagies and pizza. So you can see he's starting to get his diet a little bit healthier here. You can see the jawline get more chiseled here. And then now we're 2007, 8. You can see this is where he got his hair transplant. See his hair in the front thinning right here? So he saw this famous hair surgeon down in Rhode Island in Providence. You can see the hair thinning right there, and you can see he gets the hair transplant in between this year and this year. And I think he got his knee injury, ACL tear, I think right around this year. And then you could see his face start to chisel out more and more. And then you can see it even as he gets older here. I mean, it gets even better because now he's on an autoimmune paleo diet. His diet's totally tight, dialed in. You can see him get, even a more chiseled chin here. Maybe there's some plastic surgery. Who knows? But you can just see. Look at this here, and then look at this here. I mean, just in 8 years, he's a different person. I
Yeah.
mean, that person is not the same person right there. That's crazy, right?
Yeah, I'm sure his gut's better too. So,
Oh, absolutely. Isn't that crazy though?
yeah.
And this is a lot of this is inflammation reduction. Obviously, a hair transplant between here and here, autoimmune paleo diet, a lot of nutrients, a lot of red light, a lot of other kind of cutting edge, pliability technologies to improve skin. We could talk about other things that we can do on the hair side and skin side from a routine standpoint that can also help. That's not, plastic surgery. That's more natural too.
Yeah, I mean, my gut, when my gut was the worst, my skin was the worst. So we see a lot of guys in their 20s that come to us and they say, "Hey, I just want better skin. I want to get rid of the acne." And I always tell them, "Look, like your skin is going to be a side effect of fixing your gut. Internally, there's likely a combination of toxins happening. And so if we just do all these topicals, I've seen like collagen peptides marketed for topical use now, like collagen creams and stuff for the skin, which I think topical stuff is cool, but I don't know. I've seen people spend hundreds of dollars on that stuff and they still have terrible guts. And I think that's really where it's coming from.
Yeah, my general recommendation first is get your diet 100% dialed in. So you can see Tom here as he went 2008, 9, 10, he switched to an autoimmune paleo diet. So he was really dialed in with inflammation, really good proteins, really, working on the good fats, avoiding the excess omega-6, processed vegetable oils, really focusing on fish oils and coconut and, good healthy fats, making sure we're digesting those foods, right? Remember, your skin's made out of keratin, right? Keratin, same with your hair. And we need healthy protein to build that. And so healthy collagen, bone broth, collagen peptides, good healthy animal proteins, making sure grass-fed, pasture-fed, organic, high-quality egg yolks, all those things are going to help provide the raw material to build your skin up. And again, just because you're eating it does not mean you're digesting it and absorbing it well. So you really want to make sure you are fully dialed in on the digestion side. So that means adequate hydrochloric acid, adequate enzymes, making sure we have good regular bowel movements. And again, doing some testing. Do we have dysbiosis? Do we have any bugs or, rate limiting pathogens, salmonella, E. coli, um, you know, Yersinia, H. pylori? Do we have dysbiotic bacteria, SIBO? Do we have parasites? Do we have yeast overgrowth? These things, even with great digestion and a good diet, they could still be an impediment to optimal absorption and assimilation.
Yeah, well said. I had a guy yesterday. He was 21 years old and he was so frustrated because he's like, "I'm eating animal based. My diet is basically beef, fruit, plantains, maybe a little bit of rice." Like he's eating so clean, but yet his skin looked terrible. And he's like, "Why, man? My diet's so perfect. I follow the nutrition guys online. Like I'm doing everything they say." And we look at his stool test. He has H. pylori, he has dent amoeba, and I forget, there was some candida, there was some mold. So there was 5 or 6 things that added up to create this. And so I told him, "Man, look, like good job. It could be worse if your diet was terrible, but you're not going to eat your way out of this. Sometimes we have to work internally to fix the external." Look at this too. This is you've probably seen this before, but this was just like a Science Direct hypothesis article. Why do humans get acne? And it talks about insulin and it talks about
Hmm.
inflammatory foods and all that. Anyway, it talks about how here that acne in 12 to 25-year olds in the Western developed world, 85% of people this age, so 12 to 25 years old, 85% of those, they have acne. And then if you go into the later part of the paper, it's talking about how that there's two non-westernized populations, the Kitavan people
Katavans, yeah.
and Katavans. Okay. And then you've got, how do you pronounce that one? Aki.
Yeah, Aki. Yep.
So the hunter
Paraguay.
gatherers in Paraguay.
Yep.
And then you have the New Guinea people,
Yep. Papua New Guinea. Yep. Yep.
and they have completely absent. Like acne doesn't exist.
Yeah, and if you look at the Weston A. Price book, Nutrition and Physical Degeneration, this used to be a mainstay in medical school when medical school actually focused on nutrition. They Weston A. Price was a dentist that basically traveled around and looked at all these untouched societies from man. So they weren't eating industrial products; they were kind of living off the land. He went in with kind of a vegetarian bent on it, thinking, "Oh, I'll find all kinds of vegetarians and vegans because that's a healthy thing, right?" But what he found was there were no vegetarians or vegans unless meat was not there, and anytime meat was there, they always ate it. And so meat was never this thing of like, "Oh, it's bad for the animals" or whatever. It's like, no, animals are nutrient dense, and if they're there, we eat them. And he'd always found that the societies that were most robust had lots of animal protein. I mean, you can go to the extreme of it. The Maasai in Africa that were literally eating cow's blood and raw cow milk and honey. I mean, that was their diet. Like the Maasai. You can Google that and search that. But he looked at their dental structure, saw nice wide palates, beautiful teeth, and we could even pull some of these pictures up.
Yeah, do it, man. They're
Weston A.
beautiful
Price.
photos in that book. And the crazy thing is too, like am I've suffered because of who knows, I guess my great 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 grandparents because my jaw is smaller. I had to get my wisdom teeth out, and that's a very, very common practice now to remove wisdom teeth. These hunter gatherers you're describing, they didn't have issues. All of their molars came in perfectly. So unfortunately, like we can do looks maxing up to a certain point, but you're also going to be looks maxing for your future generation, meaning all the things you're doing to turn off these genetic issues by eating healthy, fixing your gut. You're helping your children and your grandchildren hopefully have even better dental structure because there's nothing I can do for me to get my wisdom teeth back. They're gone. They're extracted. They're gone. And that's just the way it worked out. But this is a common thing that used to not happen. There's in Dr. Price's book, he looks at those third molars and these African tribes you're talking about, their teeth are freaking perfect.
Yeah, I mean, what you could do is you could do some because if you have that narrow kind of arch, there's different myotherapy you can do. My wife is doing it right now, where you have a device and it's molded to your teeth, and you have a little crank, and it widens it. And so there are some kind of non-invasive methodology that can be helpful. But you can see, I mean, look at these. This culture right here. These are Africans right here. They survived on banana roots, nuts, honey. I know the Maasai were doing lots, and then you can see right here, beautiful arches, right? Wide jaws, really nice. Then you can see right here, Africans starting to eat. They call it white man's food,
I
and they
only see
called it
the
like a
first
lot
one
of.
so far.
Oh,
I see the four.
so
Okay,
you
here
can
we
see it
go.
right here.
Yep.
So here they are, right, eating their natural diet, and then within a generation later, this is where a lot of the processed food, they called it white man's food, right? And again, this book was written in the 40s, so it's not politically correct. But you can see, look at the teeth right here,
Mind blowing.
amazing.
Flour and sugar primarily is what he's talking about, and like pasteurized dairy.
Yep.
Or I don't even know.
Talk
Was
about
pasteurization around? I guess it was.
probably. I don't know. It's a good question, but you could see here, the dietary changes. The African and Swiss, they ate high quality dairy products. They even had some whole rye bread back then too. So it just depends, right? And again,
1862. I'm sorry, the year 1862, that's when they first started pasteurization. And so I believe in the book, though, he talks about like sweetened milk, or maybe that's the Pottinger study. I get them mixed up, but either way, I'm trying to help people understand what the white man foods were. And it was primarily flour and sugar, but I think it was also more conventional or more like processed, maybe sweetened dairy. Do you remember that?
yep, exactly. And again, Price was a dentist, and so he was looking at this from a dental perspective. And so he was looking at it as like, hey, can we look at people's health and try to get a take on their diet and how it impacts their nutrition? And so that was a really kind of a cool situation here. I'll pull some more pictures up here so you guys can see. Here's another good one. So you can see here these people's faces. And then down here, dialed in, and you can see the diet. This is a generation or two off the normal diet, and you can see the teeth and the cavities and the lack of dental health. And again, a lot of these people, a lot of these Aborigines, so you can see here, talk about lower fats, lower saturated fats, carbohydrate laden diets, and they were starting to eat more processed sugar and getting more calories from sweets. So that was the big thing. So again, the first thing I look at here is you're going to have higher quality facial structure. And again, this may be a generational thing, it may not impact you, you can get your palate whitened. There's natural myotherapy ways to do it. There's a great book out there called 6 Foot Tiger, 3 Foot Cage, talking about widening your palate and why that's important. So that's a thing. But just getting the inflammation down can help your face. And for a future generation, getting your nutrition up can significantly help improve palate structure, widening that inner third, being able to breathe better, that narrowing of that middle third can also create a lot of breathing issues. And then also just getting the inflammation down and having the nice hormones to build that strong jaw if you're a guy, on the testosterone side, or having the healthy hormones as a female, the progesterone and the healthy estrogen, and not having this estrogen dominance to build the healthy collagen and elasticity, healthy hair and healthy skin. Hormones play a big role. Nutrition plays a big role. Collagen, bone marrow, healthy building blocks play a good role. Avoiding the inflammatory food that's driving more cortisol, that's driving that subtle inflammatory half moon face. Maybe not cortisol levels of half moon, but definitely driving that more inflamed face. That's taking away the subtle jawline features that you have.
Some of it is related to mold as well. I
Hmm.
notice a big difference in people. They'll say that their hands, their feet, their face, they just have full body swelling because of mold. So mold messes up your mineral balance, and so the kidneys get affected as well. We've seen people that are in kidney failure, kidney disease that have issues with swelling. So some of it is regulated by the kidneys, and so we can use herbs to support the kidneys. We can use astragalus. There's certain mushrooms that can help support the kidneys. So we try to factor that in as well. You and I are not just working on cortisol, we're working on the microbiome, we're supporting the liver, we help to work on the adrenals, we look at the kidneys. So the whole body is involved with this process. And I think you can see significant changes, especially with dark circles under the eyes, rashes, histamine problems, all that can be improved.
Yeah. And here's an interesting, and again, this is like a picture book, right? If you don't even want to read it, it's like, okay, Australian Aborigines, right? You can see the nice wide arches, straight teeth, no cavities. Again, modern diet, they're starting to add in more processed food. The tooth decay starts to happen. And then you can see over here, the faces start to get narrow. What you'll also look at is a shorter, you won't have a symmetry in the thirds. All right. You start to have this lower middle third here. Start to see that chin. See that chin? It doesn't jut out as much. You don't have that nice kind of, that chin that goes under your nose. It kind of is a malformed a little bit. That's nutrition's going to play a major, major role in that. They call it like the rule of thirds. So part of like attractiveness is going to be having symmetry in the face. And so you want this third from the bottom of your nose to your chin. So if you make your thumb right here, should be a third. This should go right here to where your eyebrow is. And then from your eyebrow, it should go to where your hairline is. That's like even thirds. Okay. Now, one thing you'll see, there's actually studies on it, is that people that are more gluten sensitive actually have a higher upper third, right? So think of like Peyton Manning, right? He's got the big upper third, right? But you could type in gluten sensitivity and large upper third. They actually found it as a diagnostic means to look at people and say, hey, you may be gluten sensitive. Now, if your hairlines move because it's receded, that's a different story, right? It's kind of where your hairline was. And but I'll pull a little study up on that in 1 second.
That's interesting.
I
Yeah.
know.
And
Isn't that
this
nuts?
is so the crazy thing is too, I mean, I don't know what it's like in town where you are, but at least where I am, almost all the women have Botox.
Hmm.
And so now you don't even get to see what the natural beauty is because they're tweaking things. Do you know about this eyebrow procedure? I know there's somebody out there that's going to, school me on the real name, but there's these things they're doing to increase the peak of the eyebrows. There's these something with a B. They do the eyelids. Have you seen this? There's some freaky stuff, man, that people are doing. Have you seen this one? It's
I've
called a
seen some.
bless. It's a bless something.
Yeah.
BLES. What the heck is that? It's a surgery that people are doing on their eyelids. Okay, I believe it's called a blepharoplasty.
Hmm. Yep.
Okay, and this is the surgeon cuts into the creases of the eyelid, is what they're doing.
Yep.
But people are
And
doing this stuff, and it's like, well, have you addressed your kidneys? Have you tested yourself for mold before you go and fix your sagging eyelid? So here's what they're doing. See this word? That's what I couldn't think of. Blepharoplasty. Do you
yep.
see this?
I'll pull it up. Yeah, this area is the
Blepharoplasty.
yep.
I know somebody's grilling me on this.
Blepharoplasty. Blephra. That's the area
Yeah, but
of that
look,
eye.
they're
Yep.
okay. Sounds beautiful, doesn't it? Let me just cut into the crease of your eyelid to help you.
It's
Why?
crazy.
I mean, I know
Yeah.
maybe there's some extreme cases, but, like, have you done any functional medicine stuff before you've cut into your eyelids?
I know, right? I mean, the natural thing is ideally using microneedling, ideally using red light, ideally using kind of natural nutrients to bring elasticity back. I mean, don't get me wrong. If you're at a certain age and maybe there's collateral damage because you can't go back and, take back of the years that you ate poorly or didn't do the right thing. And so that may make sense, but we want to be more on the preventative side on this whole thing as well. And so here's the study here I want to pull for you guys so you can see it. This is really cool. Just so you can see I bring the receipts.
Maybe you should interview that guy, Dr. Felix, that 6-foot tiger, 3-foot cage. Sounds interesting.
Oh, yeah, doesn't it? So right here, it's talking about the development of the cranial proportions as a result of genetic, embryogenic, and environmental factors. This is celiac, but again, you can be non-celiac gluten sensitive and potentially still have this issue. Celiac is a genetically inherited disease that impacts adulthood. And then data on the effects of gluten on craniofacial development in celiac children are not available. But here's the cool thing. The main finding studies that Caucasian Mediterranean adults, individuals tend to have a particular aspect of the face characterized by a larger forehead when compared to the general population.
Huh.
And so this cranial structure can be seen in celiac, but I think it's because celiac impacts nutrient absorption, right? And so when you have poor nutrient absorption, those bones in the face are not going to form right. So you can see this one right here. So I can find this girl here.
So all y'all with big foreheads, we know
So you
what's going on.
so you can see right here, this girl on the right, that's a shorter forehead, and this girl on the left, that's a bigger forehead right there.
Does
This
it
girl's got
say
a bigger forehead.
if you click on it, does it say, "Hey, this girl had this girl didn't," or no? Does it not give you a caption on those photos?
I actually had this whole study downloaded, and it did do that. Let me see if I can download the full issue. I'll download it and pull it up if I can.
Now there's gonna be people out there trying to hide their foreheads so you don't know they're gluten sensitive.
I know, but it's a great way. My wife and I go in the airport. I remember I saw the study like 10 years ago. I was like, hey, I can walk around the airport and diagnose people with gluten sensitivity. And again, this is more about celiac, but don't
Mhm.
get me wrong. You can still be non-celiac gluten sensitive and still see the problems.
Looks like they won't let you download it unless you
Yeah.
subscribe to the journal.
Yeah. But you can see right here, because I have the study here, the big thing to look at is this girl, bigger forehead, gluten sensitive celiac. And then it's comparing this girl here, who's the same girl here. This girl here is the same girl here. And then they're showing someone with a smaller forehead who's not celiac. So you can see the difference in the forehead size.
It's pretty interesting.
Isn't that nuts?
Yeah.
Yeah. And this is the study. Let me try pulling it up with Science Direct, see if I can get it here. Let's see here. Does me the maybe get the full study here. Nope. Okay, but you can see it. So yeah, it shows celiac control woman who's been cut into two halves. Yeah. And so what you're seeing is the bigger forehead is the celiac girl, and the one who's not is non-celiac. So that's the big take home on that. So if you want to be diagnosing your celiac friends or your gluten sensitive friends, you'll be walking around the airport doing so with ease. So
Yeah, wow. So what do you
so
do? Well, people need to get their gut looked at, I think, at least once. There was one person in the comment, they said, here, wish you could afford testing. It's not that crazy expensive to just do one lab. One lab. You could start there. If you can't do the full workup, you don't have to. If you can do one thing, an oat test could be amazing for you, stool test could be amazing for you. And there are some cases where people just literally can't, and we just have to try to come in and give them some gut remedies and help them with no testing. But it's better if you can get one piece of data. That way we could specifically see what you need, because the herbs and the protocols used to, let's say, target a parasite are going to be different than targeting a yeast or a fungal problem. There is some overlap with the herbs. There is synergistic effect to what we do. So if we're hitting bacteria, we might hit yeast. If we hit yeast, we might hit parasites. Some of the herbs have some of this crossover effect like that, but ultimately it'd be better. You're going to save some time and suffering if you can just get a little bit of data. I've seen people buying $100, $200 skin creams. Spend a little more, you can get a lab.
Interesting. Yep, I think that's great. I mean, I think you start with the hormones, start with the gut. Those are my kind of big things out of the gate. But again, if that's too much for you, right? Get the diet, get the inflammation, get the nutrient density dial in first. And then regarding some of these things we're talking about, it's like, hey, this is going to help you, but some are going to help your future generation. So, if you have these narrow palates because your parents, did the wrong thing and you're paying for their sins, so to speak, we may not be able to get some of that back. We may be able to do things like mewing, which is a technique where you can do tongue placement. Again, this was popularized by John Mew, who is an orthodontist, and basically he theorized that proper tongue posture could influence jaw development. And so he put the entire tongue flat against the roof of your mouth, extending all the way back to the soft palate, not just the tip. Your lips should be gently closed to create a natural seal. And then you would nasal breathe. Breathing should be done through the nose. And the teeth should be slightly touching, almost touching with the lower jaw relaxed. And so that's kind of helping essentially to widen that jaw by keeping that tongue nice and flat. Breathing through the nose allows more parasympathetics, and it prevents you, when you mouth breathe, it gets more of these scalene muscles in, and you kind of jut your head forward. So sinus breathing tends to be a better way to activate the parasympathetics. And so that's kind of a way of correcting posture, pulling your head back, not going forward with the scalenes, tongue on the roof of the mouth, sealed lips, nose into the nose, and teeth slightly touching. That's going to be kind of your mewing exercise on that front.
And a lot of this happens naturally during breastfeeding. Breastfeeding, it helps to
Yes.
expand that palate. There's studies that look at breastfeeding versus non-breastfeeding, and the children who don't breastfeed, they don't have that expansion. They don't have that motion to get everything fully developed. So a lot of kids now, they need speech therapy to really help get that tongue placement right so it can actually push that palate outwards. That's my understanding of it. I did a podcast with a guy named Dr. David Buck. He's a dentist who does a lot of different specialized facial appliances, and he was telling me, which is really cool, but he was telling me that just by doing, say, mouth taping, you can actually shrink the inflammation in the turbinates. So if you are mouth breathing, you're increasing inflammation up here, but just tape the mouth, forces you to nasal breathe while you're sleeping, you're automatically going to be less swollen. So I've noticed a difference. The mouth taping really helps me. Have you tried it?
Yeah, I mean, I think it's great. I mean, like you can do some of the mewing stuff during the day where you just put your tongue on the roof of the mouth, spread it out, really focus on breathing to the mouth, which essentially is mouth taping. You're just not taping it, and really focusing on that as your kind of natural way of breathing. That's going to be very helpful for your jaw and for your facial structure. Much better. And so that's a good start. And then you can go to a myofacial device where you know, 6 foot tiger, 3 foot cage, and look at a myofacial device to open that up if you are like some of the Price Pottinger people. I got mine tested and mine was not that bad, they said. They said, no, you don't really need it. My wife was worse, so we did it with her. I think it's like a $5,000 or $6,000 investment to get going, a couple years, and she wears it primarily at night and a little during the day. And like her jaw is like, I think it's widened this much in the last like year
Whoa.
and a half.
Does
It's
she
a
have
lot.
headaches or anything from it?
No,
From
pretty good because you have a crank and you can self pace it and you just go very slow one at a time.
Okay.
So you can do that, and then again, getting your inflammation down. Now on the skin, you can do microneedling, gentle microneedling on the face. Make sure you're changing, you know, the microneedling tips. Get a really good quality Dr. Pen 8. And at 0.5 millimeters is usually good around the face. Maybe 1 if it's deeper, if there's scarring. Again, find a good esthetician if you need to kind of walk you through it, at least initially. But I have some videos on this topic. So microneedling is great. You can do it on your hairline, a little bit more, like 1 to 1.5 on the hairline. You can go up in front, do your temples, do the vertex. And again, we can also do, for guys, hair loss is a big thing for looks maxing. So if you're younger, be more preventative with keeping DHT down. Now you don't have to jump on a drug, but you can do saw palmetto, about 380 milligrams a day in 2 divided doses. And you can do it topically as well, massage into your scalp, as well as orally. So you get it kind of get that DHT level down and work on the receptor sites because saw palmetto is gentle, is a lot of vitamin E. It'll block the androgen receptor sites in the hair and also lower that AR enzyme, which converts T to DHT, testosterone to dihydrotestosterone. So we can at least be more preventative on the hair with some good essential oils like saw palmetto and orally and externally. And then even some castor oil or pumpkin seed is also great too, without having to jump to a drug. And then you can add the microneedling in too as a good starting point to be on top of your scalp health.
Yeah, I haven't messed with it, so I don't know a ton about it. I've read
I do
some
it.
papers on it,
I'm
but
on it. I do it daily. I've been doing it for years. I have a lot of male pattern baldness in my family, so I'm trying to be on top of it to keep my hair as long as possible. And also microneedling to help with circulation, stem cells, lots of good benefits. Again, microneedling came about from a gentleman 50 plus years ago falling. He's bald, fell in a rocking chair in the back of a fireplace, kind of got burned in the back of his head. Not bad burn, but a good burn. and then all of his hair started growing back. People were like, what the heck is happening? So the trauma of it wasn't like trauma where you had a third-degree burn, but like a light burn was enough to stimulate these hair follicles growing back. So here's this guy who's bald for years and it's growing back. And so then it's like, all right, how do we have a calculated way of injuring the hair, not doing it badly, but injuring enough to promote growth factors and blood flow and stem cells? And so microneedling was devised as a means to do it, but not create any lasting damage. And so microneedling is a great way to do it. And then you can control the depths. You can do rolling, but needling is better because you have a pen. It goes up and down like this, where when it rolls, it kind of comes in at a 45, comes out at a 40. Plus, they can grab your hair. If your hair is longer, it can pull your hair out. And so it's better to do the pens. The Dr. Pen 8 is a great one. And then you can get nice little pen heads that you rotate out so you keep it clean and sterile in between as well.
Wow. So you do that every day?
No, on your hair or your face, you can do it weekly. I haven't done it in a few months on my hair, but I have to get back into it. But it's a great way, especially if you're using minoxidil. I'd say over half the population does not activate minoxidil to minoxidil sulfate. They're missing this sulfatase enzyme, which is really important in the scalp. And that enzyme can be activated with microneedling. And so if you're a non-responder to minoxidil, you can make yourself a responder by adding microneedling in, or get your minoxidil compounded with tretinoin, and that will also activate the minoxidil. So half the population, don't get a benefit from it. So you can get a benefit by either microneedling, which has other benefits. The Japanese study in 2014 showed you improve the benefits of minoxidil by 400% with microneedling one time a week, which is crazy. Or you can get it compounded with tretinoin, which also helps. It's like a vitamin A in there, which kind of activates that minoxidil sulfate in there.
Or just get a little too close to the campfire and
Yeah, I wouldn't recommend that because you can't control that.
oh my
You
gosh.
you can't control that one. But yeah, you can Google that. I think it's even in a medical journal. You can go look at this stuff. But so we have the hair stuff. Again, hair, skin, protein, protein. Don't get burned. If you have access to red light or some infrared light techniques, whether it's your sauna or like a red light box, that's great for collagen stimulation, great for skin health. Microneedling on the face, great. Just do it the right way or see a good specialist at first to show you how to do it.
Here's a cool before and after with
Yep.
that pin you're referring to.
Yeah.
This is a lady who posted a thread on herself here. This is like a skincare post on Reddit. She's showing here. This looked like it was January 2019 and
Yep.
then August of 19. Says here 1 month after third microneedling session. Now, this doesn't say whether it was in a clinic. It just says the doctor pin. So I guess that means she's doing it at home. Is that right?
Yep.
Okay.
Yep. Correct.
So it says 7 or 8 treatments total. 37 years old, dry skin. Microneedle with the doctor pin every 6 weeks. Use hyaluronic. Washing her face using Castile soap, witch hazel toner. Couple little things, but nothing crazy. So that looks pretty good.
Yeah. I mean, there's all kinds of studies and videos on this stuff. Plus, you can do it at home. You don't want to go too high on it. You want to make sure you do 0.5 millimeter, maybe to 1 if it's more scarred. Again, if you have a lot of scarring, go see someone that's an esthetician that has experience, or a derm person that has experience that can walk you through it. Again, it can be expensive if you're always going to see a clinician. So if you can do some of it at home once a week, it's going to be better. So look at this girl right here. I mean, you can see like the ice pick scars on the acne. You can see a big improvement and shift there with this girl as well. Plus, it also helps with hyperpigmentation. So if you have like melasma or excess pigment due to maybe birth control pill or being pregnant at one point, you have this extra pigment, it can kind of help even out the pigment as well, because you're activating stem cells and getting better blood flow in there. So, and again, it's cheap and simple. It's not that hard.
Wow. So you've done your hair and you do your face. You do the skin and with the same
So
needle.
I don't do the face that often. I mean, I'll
Okay.
do red light on the face, but yes, I will do like just come through here. I have my red light where I'll do a red 635 nanometer plus an 805, and I'll have my glasses on, and I'll just kind of hit this area here as well with a red light and infrared laser I have. But microneedling is great, and then on the scalp, it's great. And 5-10 minutes to do your scalp. Keep it simple. I have some videos that walk you through how to do the scalp as well as the face. Just type in my name and microneedling, and you'll find it.
Cool.
So went over a couple of modalities here today. I mean, we went over skin, of course, like nutrients. So fatty acids, healthy saturated fats, ghee, coconut oil, omega-3s, all going to be great. Topically, my favorite fats for the skin are going to be emu oil, an AEA certified emu oil. Emu oil is one of the major fats. They will use it in most burn victim centers at major hospitals. It's the number one thing they will recommend if you have a massive burn. It has amazing healing properties. Emu is essentially like an ostrich kind of bird, and they take the fat from that bird and they create a formula out of it, a fatty acid extract out of it. And so it's amazing topically. I use it every day on my skin. I love it. It feels good. It's clean, no toxins, natural, a lot of healing properties in it. And so that's a wonderful thing. I'm also a big fan of using sulfur soap with salicylic acid because salicylic comes from white willow bark, and that also kind of exfoliates the skin, gets the junk out of the pores in a very gentle way. And also a witch hazel based toner, which really kind of pH balances the skin, clears out the pores, very gentle, not overly drying. So there's some good things you can do topically with skin. Moisturizing is one of the best things you can do for optimal skin health. Just don't get your skin burned. Good moisturization will allow collagen elasticity in your skin to maintain optimal appearance, just good moisture. Now, again, you want to internally moisture with good fats and good proteins, but externally also does help.
Yep.
I'd
Very
always would
cool.
choose internally first, but externally second. I say 80-20. Your skin and hair is made on the inside first, outside second.
Yeah, Nora Gedgaudas, she turned me on to emu oil a long time ago. I
Yes.
remember her talking about that. It was like
It's
Paleo
wonderful.
FX, like 2013 or something. I remember her
Yes.
getting onto emu oil.
I think it was also Bev Myers down in San Antonio. She was talking about emu oil on that train
Yep, yep,
when I interviewed her back in 2015.
yep.
So emu oil is wonderful. I love it.
It's very cool, very cool.
Let's make
Well,
sure it's certified, though. I'll put links to my products that I use down below. I'll do a pinned comment for everyone, just so if you want to look at it, you can find it there. But again, skin quality, talked about mewing, talked about just getting your hormones up as a guy, getting your testosterone up, estrogen down will allow better jaw structure, right? Amazingly, it will. Getting your insulin down, getting your cortisol in check will help. Getting your collagen and elasticity up. Don't burn your skin, keep your skin moist. Microneedling, good nutrition. What else? We talked about generations later, what the sins of the parents can do to the next generation. So what you can do widening myofascial therapy, 6-foot tiger, 3-foot cage as a reference. And again, that's like generation stuff, but we can still improve it now with nutrition and some of these other modalities.
yeah, and if you need help from a functional medicine perspective, if you want us to look deeper, figure out what the heck's going on with your gut, because that was my big thing was parasites. I had H. pylori. My gut was a mess. My skin was a mess. So I don't think all the topical oil in the world would have fixed me back then. But if you need those labs, we work worldwide. We have international distributors as well. So for Dr. J, that's Dr. Justin Marchegiani, that's justinhealth.com. So you can reach out there clinically and get some help. Myself, evanbrand.com. You can get a hold of us. We'd love the opportunity to help you all out.
Excellent. Again, evanbrand.com, justinhealth.com. And guys, we talked about a lot of things. If you're getting overwhelmed, work on the food first. Work on your digestion second. If you're dialed in there, then look at doing some testing or look at adding in just some simple mewing exercises. Just be at your desk, tongue on the palate, breathe through the nose, flatten your tongue throughout the whole palate. Just work on that and just good nasal breathing. Maybe you add some mouth tape like Evan mentioned. Just start with simple things. We went over a lot of stuff. It's like a poo-poo platter here. Like figure out what's the easy thing for you. Maybe you want to start microneedling your scalp. Maybe you're starting to see some hair loss as a guy and you're trying to topically reduce the DHT. Again, this is more of a guy thing, not a female thing. As a female, maybe we add in some rosemary and some tea tree oil and some castor oil. That's wonderful for hair. Females, we can use castor oil on the eyebrows. We can microneedle the eyebrows if we're having some lower third thinning. Again, look at the thyroid too, but we can also hit the outer third of the eyebrows too. So there's a lot of things we can do to kind of get the aesthetics dialed in using natural modalities.
Awesome. Awesome. Well, y'all take
Right.
care. If you have questions, comments, throw them below. Let us know what you all want to see. If you have topic ideas, we'd love to help you out. And testing wise, let's get it done. If you haven't done a lab, let's at least look at your gut one time. One time. It's going to change your life if you get the data.
Love it. Excellent.